You know? And welcome to the show. It's Lady Wu and the crew in the building, the crew being
J Hat.
and our special guest every second Sunday, MedsPlus Consulting with What's Hot in Health. Welcome, ladies.
Hello, hello.
Good to see you both.
Hello.
And welcome back. Last month we didn't meet. What was last month? February. Heart Health Month. A big month, but there was so much going on in February. I wasn't even in the city, but we are back. We are back with a lot to talk about today. So let's get straight to it. How have you all been, first of all?
We have been good, Wolves. Thank you for asking. It's just, wow, it's already March. And just looking back at January, February, and now it's March, I'm embracing the fact that we're going to have more daylight. So I'm excited. Let's go.
Yes. I'm looking forward to that too. And it's going to change a lot of things for a lot of people emotionally and mentally. Being able to get out, being able to engage more, the longer days, all of that. Everything is about to be better for you if you've been struggling. Now is the season to get back outside.
Yes, ma'am. Yes, ma'am.
Spring 4th, March 4th. Go forth. Be great. All right.
You know what, Woo? I want to say a shout out to all of my fellow SAD sufferers, seasonal affective disorder.
Yeah.
Y'all, we back. It's not pitch black at 5 o'clock now. So this is our season, fellow SAD sufferers.
It's time. Somebody asked me, is that the only season where people suffer? And I'm like, you know what? Maybe not. Maybe not. I mean, we know about regular depression, but then seasonal could also be, long days and sunny days could be sad and depressing for somebody. So absolutely not. But it is recognized that in the fall and winter season that people do shut up, shut down, and shut in. So like you said, we're back, we're out.
We are.
And more power to you. It's about to be a lot going on. While I'm talking about it, there are several karaoke dates on the tour coming up in the next week and a half. So if you see a date that interests you, a location that you've never visited, come kick it with us. That's a good opportunity for you to be outside.
That's true. Yes, it is.
All right. So in March, hey Victor, in March, colorectal cancer, National Kidney Month, endometriosis, brain injury awareness month, just to name a few of the observations and month issues to be aware of. Also in March, National Kidney Day. World Kidney Day is March 12th, which is this week. So there are a lot of things to be aware of. So we're talking about National Kidney Month and colorectal cancer. Tell us, I guess you don't have to start the conversation. That's not
a problem. Not a problem. I just want to start out by with some statistics. There are approximately 37 million people living with kidney disease, about 808,000 living with kidney failure, and 90% don't even know.
Wow.
So this conversation is going to be very important, and I'm going to let Dr. Pauline pick up from there.
Okay. Yeah, I think, whenever we get statistics, it always helps to kind of put it in context. So you think there's, probably a little shy of 400 million people in the United States. And to hear that, what was that stat again?
It was 37 million.
37 million. So that's probably 10% almost of people in America have some form of kidney disease. That's huge.
10%. And then we don't even know it. That's the piece that I can right. But just the fact that you're saying that a lot of us don't even know yet or don't know that we have this going on.
Exactly. And the reason is because in the beginning of your kidney starting to get diseased or not working properly, you may not have any symptoms or it may be something that you don't pay attention to. So are you having issues with your urine stream? Are you having, back pain? Those kind of symptoms, a lot of people, I know I'm not drinking enough water, or, I'm getting older. And so that back flank pain may be attributed to something else when really your kidneys are declining.
Oh my goodness. Okay.
Yeah. And a couple of other things too, before we get deep into the conversation. Let's start off with what is the purpose of the kidney?
Please. Thank you. Okay.
So we know we have two kidneys. Some people have one. Kidney transplantation is very, very common these days. And some people are able to live with one kidney. So what does the kidney do? The kidney filters the blood.
Okay.
It filters about 200 quarts in 24 hours. Now let's put that in perspective. We go get our oil change every 3,000, 6,000 miles,
We're
and that
supposed
requires
to. I'm overdue on all the vehicles.
well, depending on what type of car you have with the synthetic oil, you can go a little longer, woo. But that's about for our oil change, we're looking at 5 quarts. Isn't that right? About 5 quarts of oil. Yeah, if I remember correctly.
That's 7 for me.
Okay.
You got a big
Boy,
Yeah. Well, us regular folk, about 5 quarts. So 200 quarts of blood going through the kidneys in 24 hours. So the function of it is to remove waste. What type of waste? We're talking about drugs, the metabolites from drugs that we're taking. When I say drugs, I mean medications and toxins. So when we think about toxins, we have environmental toxins. We have toxins of things that we put on our body that we don't know that is being going into the bloodstream and having to be excreted by the kidney. Think about our diet. 70% of the American diet comes out of a box, a bag, a can, a jar with preservatives or other agents to make it taste good, last longer, thicken it, thin it, you name it. So those are toxins or things that the body has to excrete. So when we think about processed food, anything that's in a box, bag, can, or jar, it's been processed. So kidneys have a lot of work and a lot of function within the body.
That is a lot. And then that would bring about why people are fearful of just having one. You know, like when somebody says, I need a transplant, so I got to live with one kidney. And it's that one has to do all of that. That's a lot of work.
It's a lot of work.
Wow. Okay. So we know what the kidneys do. We know how disease can set up, and it's from preservatives and diet. I guess just like everything else. I think I saw that this is National Nutrition Month.
Nutrition Month as well.
So all of this plays into us taking care of ourselves. When you talk about the preservatives, I want to look into that more, because what are we supposed to eat? what are we supposed to drink?
That's a good question. And even for people that are quote unquote healthy eaters, you know, unless you're sourcing your food, i.e. on the farm, working the farm, know what you're putting on the plants and vegetables, we don't really know. So the more that we can eat whole foods, the better. Yes, there are going to be times when we do have, you know, some of the canned food, etc. So making sure that more oftentimes than not, that we're getting as much whole foods as we can. What do I mean by whole foods? Fresh fruits and vegetables.
Okay.
And we're deep in the heart of Alabama right now. So let's break that down into something that's real and tangible that people can, you know, start tomorrow. If you're concerned about your kidney health, you're concerned about all of these, what we call metabolic disorders, from heart disease to diabetes. What does that mean on a day-to-day basis? You know, we could go right out of this studio and see fast food.
Chicken everywhere.
Chicken. Yeah, chicken is always fried. It's always blackened. It's got 4 or 5 different seasonings. That should be your every now and then type of meal. So we're not saying, you know, don't eat the things that you enjoy, because I enjoy a lot of foods and I make sure that I consume them. What we are potentially saying is, more often than not, try to include vegetables with your food. So if you're going to have a 6-piece lemon pepper fried hard, maybe have some squash or some zucchini, broccoli, you know, greens, something with that that is a fresh green food. Also fruits. A lot of people are concerned with fruits. We teach diabetes classes all the time where people are like, well, I know fruits contain sugars and they'll increase my blood sugar. That is true, but the benefit of the fruits from being antioxidants to helping filter toxins and things like that, the water that's contained in fruits, all of those things are important for your overall metabolic health. So I know it's hard for a lot of people, especially if you're on a fixed income. Groceries are so expensive,
Yeah.
and you have to make food stretch. Even if you have to get those green beans out of a can, put some green beans on the plate with your chicken or your, whatever you're eating.
Spaghetti.
Yeah, with
Mm.
your spaghetti. Put some greens on the plate, even if they have to come out of a can.
So thank you for that. Like you mentioned, we're right here in Ansley. Even thinking about people who are near a few grocery stores, you may have an Aldi, a Food Depot, somewhere else that you can get food, or a restaurant that you feel is somewhat healthy. But the pre-existing conditions that bring about kidney damage, what are those conditions that I know more Black people have? What are those
Oh,
conditions?
yeah. I mean, it's a part of what we call cardiometabolic health.
Mm.
Cardio meaning heart. So your heart disease, high blood pressure, heart failure, those type of things. When we say metabolic, we think of things like diabetes.
Okay.
So high blood pressure, diabetes are actually the number 1 and 2 causes of kidney disease in America.
High blood pressure and diabetes.
High blood pressure and diabetes.
Okay.
Yeah. And we talked about that so many times on the show before. People need to know their blood pressure.
Mhm.
A lot of people, especially when we go into the community, we're checking blood pressures. Everyone 130 over 90, 140 over 90. We've seen some 160s, 180s. And these were young people. When we were at the Bruh Brunch a couple years back, I don't think anybody there had a normal blood pressure. Everybody we checked at the Bruh Brunch. This isn't HIPAA because unless
It
you
is
got
what
the
it
pictures,
is.
it is what it is. But everybody
I didn't remember
there,
that stat though.
yeah, everybody there had some form of hypertension.
Wow.
And many of them had no idea.
That's,
They had no idea.
That's
Or
crazy.
if they knew, they would tell us, oh, it's going to be high. When did we get to the point that we normalize high blood pressure?
What
There
does
is
that
something we can
mean?
do about that.
Yeah, what does that mean? Like if my blood pressure is high and I like, what does that mean for me?
That means one or two things. Have you been diagnosed? If you've been diagnosed, are you taking your medication every day? If you're taking your medication every day, then we need to talk to the doctor and give him the numbers or her when you're outside of the office to see if the treatment regimen or the medications you're taking is effective
Mm.
in normalizing your blood pressure or getting it within a healthy limit.
What could happen with high blood pressure? Like with those numbers like that?
Whew. Okay. So with high blood pressure, if you think about it, it's your blood vessels. It's that pressure that your heart is pumping against, which is in your blood vessels. Blood vessels, we talk about the fluid there. So one of the things I left off about the kidneys, it also regulates the fluid balance. So how much fluid you have in your vessels, that also reflects on your blood pressure.
Mm.
Your blood vessels go from your heart to your head to your eyes to everywhere in your body.
Wow.
And if we have a problem with blood pressure over time, we're going to have a problem with those organs, heart, kidney, or our eyesight over time. So that's why it's so important, number one, to control our blood pressure as long as we can.
Mm. To hear it broken down like that, the blood pressure is literally that. If it's too high, something gonna pop.
I like to use the example of the hose pipe. So thinking when you get a brand new hose pipe, it's clear. You hook it up to your house, the water runs through, fine, no problem, everything's fine. Think about that hose pipe that's been sitting out there all winter, all fall and winter. It's got leaves, it's got dirt, it's got soot, it's knotted up, and you're trying to send that same water pressure through that pipe. It's going to have a hard time getting through out to the end. That's what blood pressure is doing, and it's weakening the walls of your blood vessels, and it's causing issues. That's what sustained high blood pressure is doing to your blood vessels.
This is why these conversations are so important.
Yes.
What's up?
Because I was just doing some conversation with some guys about blood flow.
Yes, I know where you're going. Go right there, please.
And in this age and category, it's an issue, right? And so this fits right into that picture because a lot of them have high blood pressure.
And I think that's where there's been a disservice with letting our brothers know the importance of controlling blood pressure, because when we think about below the waist, that's blood flow.
Yeah.
We want blood flow everywhere. And now we're hearing of younger and younger men with high blood pressure. Now they're having an issue in the bedroom. And now they've normalized it's okay to take the little blue pill or the little yellow pill or the white pill, whichever pill you're taking, to increase that blood flow there. If you're doing that, then you know that there's another issue that needs to be attended to, not just once or twice a week, but on a daily basis.
Okay. So tending to the real issue, not just treating the one that I guess is satisfying or gratifying, actually tending to your health. What's hot in health is that twisted pipes bust.
There you go. There you go. But here's a fun fact
Man.
here's a fun fact about young men and hypertension. Typically, when young men go to the doctor, it's because they're having an issue with erectile dysfunction, and it's due to undiagnosed and untreated high blood pressure. Because you got to think, when you think about the erection, think about an erection, it comes from blood flow. What did we just say about the hose pipe? When that flow is constricted in some way, it's blocked off in some way, you're going to have problems there. And that's when most men are diagnosed, especially young men, are diagnosed with hypertension. It's because they went to the doctor about erectile dysfunction.
Crazy.
So correct me if I'm wrong. Make sure I got all this, because I know our listeners are like, what? So the kidneys helps in this functioning as well. Am I?
Not that the kidneys help in this function. We were talking about kind of the function of the kidneys as far as regulating fluid in the body and the blood pressure and all of that. And one of the causes of kidney disease is undertreated high blood pressure.
Okay.
So when you have high blood pressure that's not treated, not only can it damage your kidneys, but it can also cause erectile dysfunction.
And that's the conversation we were having. That's why I wanted to make sure I understood.
I'm in awe. Because for one, I hear you talking about the young men. So I guess I don't have to worry about this conversation. Is that what you're saying?
Not at all. Not at all. I mean, everybody needs to know their blood pressure. They need to know what it is at home, when you go to your doctor. We said this so many times. Every home in America needs a blood pressure cuff, and at least one person needs to know how to use it correctly. We need to put that on a t-shirt or something.
Yes.
Because it's so important. Your blood pressure affects so many different aspects of your body. And when it's elevated for a sustained period of time, your vision blurry. I can't see.
Right.
And
your
because you're getting older,
like that.
It's because your blood pressure,
Okay.
the pressure in your eyes is being affected by your blood pressure. And it causes people to go blind.
Jonathan, are you going to a stress?
Oh, yeah.
No, because the eyes. I just got my eyes checked for the first time. I had to put on glasses. But beside the glasses piece, she had me watch a video about diabetes and how they affect like something behind the eye that could have, that's like, it's not curable.
Yeah.
But I'm looking at how you looking about this.
Dude, because
my boy is
I drove by last year. I got my med report, so we're all good.
Yes. He sure did. Came into the office, got a full biometric screening.
Was hot in health.
Exactly. Come get it, y'all. This is not the time to be walking around talking about, oh, I'm good. We have heard that so many times. We are not good. And there are things out there to help us. We want to live long, healthy, fruitful lives. We do not want to be sick and disabled and a burden to our families.
Ooh,
think about when you go down, what that does to your family. We're having to figure out who's going to take care of you. We have to work and pay bills. Like, who's going to be at home with you?
And then, like, some of us are thinking, like, who is capable of doing that? I don't want to find out.
Exactly.
Let me drink my water and do what I need to do and eat fruits and vegetables. Okay? So, a few takeaways from that portion of the conversation. High blood pressure is and I'm going to say it this way, it may not be true. We're going to say true or false, and then you all speak on it, is a male issue.
False.
That's false.
Okay. The kidneys do everything in your body.
They do a lot.
Okay. What was another one? But we'll go with those two. So women can be impacted by high blood pressure. Basically, anybody with blood vessels can be impacted by high blood pressure.
Absolutely. And I say the reason we probably focus on men is what Jonathan brought up, and also how they're late to the doctor. We've had people we've encountered in the community that have insurance and haven't used it. Going to the doctor, just getting baseline screenings. Prevention is key. And getting those lab tests, understanding what those lab tests mean. It's not just the medication, but knowing where you are today, and then tomorrow, next month, next year, what does that trend or that comparison look like? We had a gentleman we had a consult with, and has been on is type 2, has
type
kidney
2 what?
disease. I'm sorry, type 2 diabetes.
Okay.
Has kidney disease. And also in Black Americans, we have what's called resistant hypertension as well. And a lot of times you're on maybe 3 or 4 different medications just to help control the blood pressure. Now, anybody that has to take more than 2 or 3 medications, that can become a pill burden. It can become where you're least likely to take that medication on time. So his wife urged him to come talk with us, and we had a sit down. Come to find out, looking at the labs, he did not understand what stage of kidney disease he has. So remember the statistic I gave you, 90% did not know. So he knew he had some kidney issues, but he didn't know how close he was to the mark. So why is that important to know? There are certain medications you can't take once you get closer to the mark. And then once you hit the mark, then that's where the discussion about dialysis is.
Yes.
So I was able to help him have a conversation with the doctor, called me back that next week after the appointment. And what I suggested, he went to another specialist and asked, why hasn't your PCP put you on this medication? That day, that specialist wrote that medication for him, and I'm talking about a GLP-1, which, yes, they could stand to lose a little weight. That wasn't the primary reason. The primary reason was because they were type 2 diabetic and they were still on fast-acting insulin. That's what they put you on in the hospital to control your blood sugar. When you come home, you should be on something else for the long term. So that's a lot of things that, Jonathan, if you don't know how to have the conversation.
Right.
You don't know how to start it. So I gave him an appointment guide, what to say, how to say it. But all he had to say was, I have a friend. She's a pharmacist. And she said I should be on a GLP-1. She's like, oh, yeah, I was going to ask, why aren't you on one of those?
Sure.
Yeah. In all honesty, this was one he had not seen in a while. They normally would see the PCP and the endocrinologist, but this was the nephrologist, the kidney doctor, talking about a GLP-1, which that really should have been initiated by the PCP, if not the PCP, the endocrinologist. So it was a lot of foolishness going on, but that just goes back to say these conversations, Woo, I appreciate you for this platform. It's very important because we do not know. The system is not set up to teach us.
Right. Exactly. We don't learn until we're in it. And by the time we learn it, it's too late. Some of the symptoms, like you're talking about somebody that basically was already in the thick of it. But then people that have the symptoms, Dr. Pauline mentioned the flank back pain, and somebody here flank. All I know is steak. What are you talking about?
I think it's the same part of the animal. Actually.
Really? It's got to be.
I always like to think of it. It's this back area, kind of by your by your muffin top. Right. It's that area. A lot of people have pain in that area. Yeah. But one of the things
I was just about to say sharp pain in that area.
Yeah, in that area could be associated with something going on with your kidney. But also think about it. We talked about the kidneys filtering fluid. So if you're having swelling, edema, especially in your extremities, in your legs and feet. We talk to a lot of people that my feet swell and I must have eaten too much salt. That's a possibility. But if it's happening more often, you may need to be evaluated for some type of kidney disease, because that means your body has more fluid than it should, and your kidneys aren't filtering that fluid as effectively as it should. And so it's going to your gravity is taking hold, and it's going to your feet and legs.
Compression socks. Okay. Yeah, we are learning
underlying
so much.
cause first.
Yes, definitely.
Find the underlying cause first if it's kidney disease. And if you get your kidneys checked, your blood pressure is good, everything else, then compression and elevation.
I will say this. A lot of times you'll go to the doctor and you'll report something like, oh, it's just a sharp pain. You know, I've been having these pains or whatever. You'll report that. They'll do a CAT scan or look at whatever. Oh, we don't see anything. Like I hear that a lot. I've heard that over the years. Everything looks fine. It looks okay. It don't feel okay.
Right. And I think that's where we have to learn to give the doctor more information too.
Yeah.
A lot of times we don't talk about if our bowel movement has changed or the frequency. If our water intake has increased, decreased, if we've had appetite changes, if we used to run 5 miles a week and now we don't do anything, letting the doctor know that more than just that some other things have changed, sometimes can lend itself to more testing to get to the root cause.
And you know what I think too is important? Two things. First thing is, so many of us use the emergency department as primary care. And the role of the emergency department is to get you stable and get you out of there. They are not, they're physicians, but they're not physicians that are concerned with your general health. It's for emergencies. So if you have an emergency, their job is to get you stable, whether it's chest pain or, difficulty breathing. Their job is to get you stable and out. So don't treat the emergency department as a primary care provider. That's number one. And then number two, you need to have a relationship with your primary care provider where you can tell them things that you may not tell your spouse, you may not tell your best friend, but that doctor needs to know everything,
right?
Because you don't know how one system affects the other. The doctor needs to tie that together. So you go in and tell him everything from head to toe. I've been having headaches. My feet have been swelling. I'm a man and I can't get an erection. I've been having palpitations. The doctor is going to immediately think cardiovascular, and he's going to run all the tests to figure out what's going on with your heart. But you may not have been able to tie that together. That's why it's important to tell the doctor everything. And we don't do that. We don't have the right conversations.
Okay.
Everything?
Everything. Yes. Think about it as a therapist. You can't help people with part of the information.
Oh, and they always come in with part of it.
Yes, and you feel like pulling teeth trying to get it out of them when your doctor and your therapist need to know everything.
This is not the time to shine. This is the time to be honest and let it all out. So they're your quarterback. So making sure that they can call the play. What's the next play? What's the next route we're going to take? Okay, I'm going to send you to this doctor. We'll get the results. If that's not that I need it to be, we're going to send you somewhere else. So we have to think about it in those terms. They'll be able to tell if it's something they need to consider or maybe not, or on down the line. So
right.
Capturing that history is important.
Absolutely. My dad just experienced that through his PCP. So he just had surgery Thursday and removed a 50-cent piece size tumor from his kidney, a cancerous tumor. And it came from going to the doctor. I'm waiting on him to tell me, like, what was it that made you say something about that? Because he's already had all of these different back surgeries. So like that's a constant pain anyway. But I'm wondering, like, I don't remember if there was a different type of pain or what it was, but the PCP found this mass and said, you need to go. I'm going to get you to your specialist for a CAT scan. Go and get the CAT scan, and then you find out that, okay, we got to have surgery. We need to take this out. So all of this conversation is very much like real time for me, because this is what just happened. Like, he could have been like progressively dealing with this if it had not been for that initial, you're going here. We're going to do this. This is going to happen. We're going to cut that off, and you're going to recover. That's where we are now. because of that whole chain of medical attention. So it's very important.
And you know what the sad thing about that is, so many people are scared to hear the word cancer. They're scared to go to the doctor because of the potential diagnosis. And I wanted, if I can do anything, if we can do anything with this platform, is to let people know that the majority of conditions that you can be diagnosed with at a doctor or hospital are treatable if caught early. Everything from the cancer, they were able to remove a mass that was still just a mass. And now I'm sure your dad has a great prognosis to go on and be able to live the rest of his years in good health. Yeah. Had he waited, that cancer could have metastasized to other parts of the body. We're talking about chronic pain. We're talking about all of these things that people are afraid of. But when caught early, the majority of conditions can be treated and you can go on and have a normal life.
And that's the whole purpose of screenings, is to catch it early so it can be treated and cured. So we can't get you to a 90% survival rate if we're dealing with stage 4. We passed that mark.
Absolutely.
Okay, so kidney care, making sure that, like when I hear kidney disease, the disease of anything means that it's sick. So by the time you find out that your kidneys are sick, can that be corrected?
Absolutely. Okay. Kidney disease actually comes in stages where, I think it's 0 to 5, and 5 is typically dialysis, but it comes in stages. So yes, if you're caught early, stage 0, stage 1, there are things you can do to decrease the progression. One is making sure you stay hydrated. So, it's about to enter the spring and summertime. We're going to be outside. We may be drinking and it's not water. That can damage your kidneys.
Okay.
So it's important to make sure you stay hydrated. Keep water with you at all times. If you go, me and my daughter were just at South this past weekend, and everybody I saw had a water bottle. And I'm like, this is amazing. People are, the younger generation are aware that water is so important to our bodies. And so they're carrying it around. People our age aren't necessarily doing that.
Yes, we are. But my friend just surprised us right here, but it's not my other one.
Oh, there you go.
But she has a circle. And that
makes me drink so much more water.
It does. I agree. If you have more water, you're going to try to drink it versus having, baby, this is so old. This is my tried and true. It used to be a gray one and a purple one, but the purple cap.
So you, I just water anyway.
Yes,
water and wine.
It lets me know how much I'm getting, because if I don't get a certain, my lips start to get chapped.
Okay.
Certain way. But yes, that fluid balance is so important as it relates to the kidney. So when you hear people having kidney stones and things like that, that has to do with that as well.
So let's go back. That's what the first part of the dad's issues were. Like back in the 70s, it was from kidney stones, but that was the other kidney. So once you get to the point like 40, I guess it would be 40, almost 50 years later, more kidney issues. So you really have to be mindful. And then I'm a daddy's girl to the point that everything he has that a girl can have, I have too. So that's why I'm asking all these questions. Yeah, all right. So let's fast forward to colorectal cancer. This is big in the news. A lot of celebrities here recently, and I say here recently, started with Chadwick Boseman, have died from colorectal cancer. What is that?
Colorectal cancer is a cancer of your intestine, whether it's your small intestine, large intestine. It's a cancer that has invaded that area. Now, the number one screening for colorectal cancer right now is a colonoscopy. And the thing that we really want to highlight is, in the last, I want to say maybe 5 to 7 years, maybe, the age for your first colonoscopy has actually been lowered. So it used to be 50, 45. It is now 45. So if you are around 45, you should be asking your friends and loved ones, have you scheduled your colonoscopy? Y'all have colonoscopy?
And when you schedule it, you got to schedule it at work, because you have to prep the day before. It's not just make an appointment and walk in. It is
what?
So
you got to drink the liquid.
Yes. So ask your friends while y'all out, toasting up and having a good time. Ask your friends, have you had your colonoscopy?
Cheers to that colon.
Yes. Cheers to your
Okay,
colon.
so let's talk about the test for the exam, the colonoscopy. Everybody's afraid of that.
Yes.
Why?
Because it's uncomfortable.
They were afraid of the mammogram when I went in there and got it. It was like, this ain't nothing.
No.
What are y'all
People hype stuff up in some of the most negative ways. And all it's doing is preventing you from taking care of yourself. It's scaring you out of creating stigma. Exactly. Scaring you out of something that really you've done worse on a good day.
I mean, while you were out celebrating and you couldn't hold it no more. It just came out.
Okay.
So for this colonoscopy, what you will do is get a prescription to the pharmacy to be able to get a solution for the powder. You add water or tablets. Thank you, Pauline, for that tip back in the day. For the tablets where you still have to drink the water.
Okay.
And it's timed on how often you drink it. But prepping before that, you have to go to clear liquids. You can't eat any food. You can do like Jello. There are certain flavors of Gatorade that you can do. If you think about it, they're putting a scope in there, a camera, so it has to be where they can see, and they're looking for polyps along the intestines, the colon.
Okay. Polyps being little beads, little.
Exactly. Think of it like a little bead off the colon.
Okay.
It shouldn't be there. There are precancerous and cancerous polyps. So they send the scope into your rectum, and they look all the way down your colon, and they're looking for areas that should not be there.
Okay.
Now, I guess coincidentally, they've also diagnosed things like diverticulitis, and so when my husband had his, they said your colon is a little bit darker than most people's. Do you take any supplements? And he was taking, I think it's soursop juice or something. And when he said that, the gastroenterologist was like, "Oh yeah, okay, I've seen that."
Okay.
Again, that's why it's important to tell your doctor everything.
Yes.
But yeah, so they look for these polyps. Typically, when you get it screened like it should be, especially if you don't have a family history, they'll just remove the polyp and say, "See you again in 10 years." That's what we want.
10
years. So it's no, because the thing is, it takes these polyps. It takes a long time to grow.
Okay.
And so they're not really, unless you have a lot of polyps and they pulled one and send it to the lab and it's cancerous. Sometimes they can tell you to come back in a year or 3 years. It just depends on what the GI doctor sees.
Okay.
But the important thing is that you're clear, so he can see your full colon, and that he removes the things that are there that should not be there. That's the main thing about the colonoscopy.
Can we go back to the prep?
Yes, I was going to ask where is the colon, and then I want you to tell about the prep. Where is it exactly?
So the colon is in your lower abdomen. So if you think about, you come down, here's your anatomy lesson for today.
Okay.
You come down on your throat, you have your esophagus, you have your stomach, and then emptying out from your stomach is you go into your small intestine. And from the small intestine into the large intestine, and I forgot, we learned it in physiology. You remember how many feet? I mean, it's like a lot of the colon is just wound up in your stomach. And so they go through that whole thing looking for polyps and lesions that shouldn't be there. And that's what a colonoscopy is, a viewing of the inside of your colon.
Wow.
In order to do that, to get that clear, think about when people detox and take these things that make them go to the bathroom to empty the colon, basically is what you're trying to do. So you're going to go so many times to where it's going to be clear when you use the bathroom, or it won't be formed. It's going to be as if you had diarrhea. Just remember, when you are wiping, after you use it, you're going to start to get chafed, or think about the baby's bottom when they have a rash or something like that. So I tell my customers to get you some wet wipes.
Okay.
Or if you don't have any Vaseline at home, pick you some of that up as well too. Unless you have a bidet at home, which I don't have. But it's going to get to where you're wiping, and it's going to be so irritating to where, as you continue to go and that fluid hits the little raw spots, it's going to be very uncomfortable. So
and here's another tip for avoiding that if possible.
Okay.
Number one, don't wipe pads. So I think that's a tangible thing that you can do to help. I mean, it's still, you still have to clean the area, but don't wipe pads. And number two, if you've never invested in 2 or 3 ply toilet tissue, this would be the time.
Okay. Okay.
This would be
Okay.
the time.
So it's not even
not
really the
get the
test,
big
it's the
one.
after effects of the test.
Well, I mean, it's
No,
not
it's the prep.
pleasant. It's the
Oh,
prep.
it's
the
before.
test
This
is
is before. This is before
The
you ever
before.
go. This is the day before.
the test. You're asleep,
Right.
and then when you
and
wake
it's
up,
a good sleep too.
yeah. I tell you, my after colonoscopy was pancakes and bacon and Cracker Barrel.
Okay.
Mhm.
But y'all,
So I mean, we don't want to scare people
No.
about the prep, but we do want you
I
to be
want you to be
prepared.
prepared.
We
And
want you to be
anybody that
prepared.
asks me that, I tell them that, and it's like, hey, thank you, Jen.
2-3 ply tissue,
Wet wipes.
And
soap
Vaseline.
wipes and Vaseline.
Just in case you may or may not need it. But
Okay.
that was something I wish I had known. So I make sure I tell everyone I know.
Okay. That's how we're supposed to do. That's the whole purpose of What's Hot in Health with MedsPlus. If anybody needs to get in with you guys and ask these questions, get some consultation, some support, how can they find you?
Yeah, they can reach us at our office. We're open Monday through Friday, 9 a.m. to 5 p.m. We are downtown Birmingham in the New South Federal Building on Richard Arrington Jr. Boulevard North between 2nd and 3rd Avenue North. Or you can call us at 205-650-4636. Actually, call or text, either one. Either one. But you know what? I want to go back to colorectal cancer because we talked about the prep, we talked about the actual procedure, but I think it's important we talk about stats for kidney disease.
Right.
And I just pulled them up just to illustrate how prevalent this is.
Yeah.
So colorectal cancer is actually increasing in people 50 and over. So that's 50 and under. Again, that's why they lowered the age to 45. And I'll tell a quick story about me. So I had a primary care provider. And when I turned 45, I knew this was coming. I was like, I'm just going to do it. I'm going to go in and we'll get it done. When I turned 45, went in and told her, okay, I need to get my colonoscopy scheduled. Her response was, I usually don't recommend it until 50, but if your insurance pays for it, then you can go ahead and I'll schedule you for it.
Girl, I was like, give me the test.
And I was like, no, actually, the recommendation has changed. It's now 45, which I am. So, and she's like, yeah, but I wouldn't, no, ma'am. And so my next visit was with a different doctor. You're not going to ghost like me out of what I'm doing. I don't want to do this, but I know I need to. So I went and found another doctor, and my colonoscopy was literally scheduled the day before Thanksgiving that same year. Because I'm not playing about my health. That's one thing I do not play about. So here's another tip for MedsPlus. Know what your what screenings and things like that you're due for based on your age.
Yeah.
And do not back down. Do not allow anybody to tell you that, oh no, I'd rather you do it at so and so.
Because why?
If the federal government and the researchers and doctors have changed the screening age, it's for a reason. It's because we're seeing a higher incidence of colorectal cancer in people under 50.
Tell me why though.
It was a multitude of reasons.
Okay, so if we think about it, we go back to, this is Nutrition Month. So a lot of it has to do with the food that we're consuming. So making sure that what we talked about as far as getting whole foods as much as possible and fiber.
Okay.
We are a fiberless society. So getting those things into our diet is very important. As simple as eating oatmeal for breakfast. Ditch the cereal, eat some oatmeal, put some nuts and blueberries in it, or something that you like.
Sugar. Okay.
Yeah, brown sugar is good too.
Okay.
Then even if you don't like oatmeal, maybe getting some Metamucil or something and adding it to a drink. It's a tasteless additive to help increase fiber.
Okay.
And we always recommend when you start fiber, go low and increase slow because you have to increase your water intake. So if you're not hydrated and you're adding fiber, you're adding another problem. So being very mindful of what the fiber is going to do, you have to increase your water intake as well. Once you get accustomed to that, then you can go up to the full dose. I always recommend half dose first.
Okay. Great tips right now, MedsPlus. If you're trying to get more information, you heard something that's speaking directly to you, 205-650-4636, located in the heart of the city. We have talked about kidneys. We have talked about colorectal cancer. And I think colorectal cancer is such a big topic because so many prevalent people, actors, are dealing with, have dealt with, and ultimately succumb to colorectal cancer. What does the treatment look like?
Oh, I was just going to mention one recent celebrity.
Yeah.
Actor James Vanderbeek from
Yes,
Dawson's Creek.
Dawson.
He was
Yeah,
48.
years old, and he admitted that he initially dismissed changes in his bowel habits as just being something dietary that he was eating to cause the change. And that's a story that doctors hear over and over again from young patients. So making sure that we are telling our doctors about any bowel habit changes and not accepting it as, oh, okay, so I hear people having that, I guess that's my new normal. No, let's look into it and make sure. If you see blood in the stool, unexplained weight loss, abdominal pain or cramping, iron deficiency anemia, especially in younger women, that can often be misattributed to their menstruation cycle. So young people can sometimes see the doctor 2 or 3 times before a correct diagnosis because symptoms can get dismissed as hemorrhoids or stress. So being knowledgeable and educating yourself on those signs and advocating for yourself can make a difference in how soon you can be diagnosed, if that's the problem.
Wow. Okay.
And you know what? Just to bring that home, I think it's important to, number one, address it from a nutrition standpoint. So like we said, fiber, water, making sure you're getting all the nutrients that you need. Number two, monitor your bowel habits. We talk to people that may have a bowel movement once a week. That is not normal. If you're eating 2 and 3 meals a day, your body, well, think about when babies are born. They eat, they poop. They eat, they poop. That doesn't stop when you become an adult. You're supposed to have regular bowel movements. That's your body's way of getting rid of that waste.
Yeah.
If you have 2, 3, 4 days worth of waste just in your colon, you're full of it, and it could negatively affect your health.
Why would you be thinking that is normal anyway?
Right, exactly. Because you haven't thought about it. It's not on your radar of things. You're concerned about how you look
on the outside.
You're gonna make sure that face beat and them nails done.
And your
Your
stomach
colon
hurt.
is nasty.
That's horrible.
Anyway,
That's crazy.
So yes, so I mean, just it's so important to talk about these things and to normalize talking about these things so that people can go and talk to their doctors and get these screenings. So nobody should die at 48 from colorectal cancer.
Okay.
And the
should not.
other thing we need to add to, we haven't talked about, is physical activity or exercise.
Okay.
We're a sedentary society, so making sure as the daylight is happening, get out and walk or wake up in the morning and do a brisk walk or something, and making sure that that's actually what activates the muscles of the intestinal wall to move as well too when you are constipated or need more water. On top of that can actually help to get your bowels moving. So staying active, also cutting back on alcohol, smoking, and the other one is limiting red meat.
What?
Like, you can eat it. You can eat it. I said limit. I didn't say not eat it because I eat it too.
What's red? What does red mean?
So we're
Beef,
Beef is what's for dinner. So what am I supposed to eat?
chicken.
You have chicken. You have fish.
Turkey.
You have protein-rich chickpeas, kidney beans.
Beans.
Monday you can do vegan options, meatless Mondays, things regarding that, and then that's also going to help get you more fiber and move them bowels. So the goal is to move them bowels.
That's right.
Gone with the move them bowels.
Line names.
Them bowels.
Move them bowels.
Yo, what's hot in health with MedsPlus Consulting? This is always a good conversation, always great information. A lot of these things we learn from people who are sick. That's when we learn, like when we see somebody that's dealing with it. But the idea of this Second Sunday segment is to help you get in front of it. Be preventive, be proactive. Today's conversation, colorectal cancer, National Kidney Month. Also, just putting looking at the other ones, there are a couple of other ones that we are paying attention to this month. Endometriosis. You hear a lot of women talking about that. We're not going to tap into it just for time right now, but talk to your doctor about it. Ask the questions about it. One that sticks out for me this month, brain injury awareness. Like, people don't really recognize how prevalent that is and what's considered a brain injury. A concussion is a brain injury and can change your whole life. But if you had any of those issues or any type of injury to your brain, follow up. Pay attention to the changes and what's happening. Anything else, ladies, before we get out of here?
Yeah, I just want to, going back to colorectal cancer, we've been asked about the tests like Cologuard and the FIT test.
Mm-hmm.
Those are actually good, especially for people who, for whatever reason, can't go through the colonoscopy. But every time I'm asked about it, especially for someone who is, around the age of 45, I always tell them it's better to have a gastroenterologist look first, and then for your subsequent screenings, you can use one of those tests. But I'm the kind of person, if they can look and see my colon and look for polyps and all of the diseases, I'd rather them look first. So if you can get a colonoscopy, that's number one. But if for whatever reason you can't or you just don't want to, definitely things like Cologuard, that's where you provide the stool sample and send it off, can be helpful.
Okay, cool.
And another thing I want to add, when we're talking about our kidneys and the way we talk about how it filters everything we put in our body, this is a whole nother subject, but I just wanted to mention briefly, because this is something we see in practice. So many people taking so many supplements because of what they saw on social media, what my girlfriend taking, what so-and-so is taking. This is what happens to them.
Soursop, sea moss, black oil seed.
Yes, and it's better to test or to have a lab or have labs done to see if you have any deficiencies or if something needs to be improved and evaluated by a healthcare professional than wasting money and adding injury where there was no injury. So we have to be mindful of that as well. We do take Tylenol acetaminophen or ibuprofen or other NSAIDs over the counter. They also can damage the kidney. So we have to be mindful of what we're putting in our body. Everything we take can possibly have an effect on us.
And even some of the things we do. I just thought about kidney injury. My daughter had a kidney injury from over-exercising. So we have a sickle cell trait, and our kidneys are impacted by having the trait. And she overexerted, and there was kidney damage. She was sick from that. So, those type things, there's an extra layer of supervision and prevention that we have to pay to things because of sickle cell trait. I'm not going to wait until September to talk about it, but we'll talk about that soon. But the kidneys are impacted.
Yeah, absolutely. Acute kidney injury is real. The good thing is once you remove the offender, whatever it was, your kidneys will improve. But acute kidney injury is real. So definitely pay attention to your bodies. That's why we're here every month. It's just to make sure people are aware and take care of preventive care, because most of these conditions that we're suffering with, we don't have to, especially in the Black community. We are disproportionately suffering from these diseases, and we don't have to. It's about awareness, prevention, making small, sustainable changes to improve your health, taking medication when it's prescribed. All of those simple things can help us improve our health outcomes.
Yes, Jay, had you got anything else you want to add?
I'm floored. Thank you for the information. Because in my line of work, I do have these conversations because people don't want to. Well, Black men don't trust doctors. They just don't. And then it's an ego pride thing, I believe, that taps into that. So the information is valuable, and I shared it. And so I got to get that test.
All right. I'll go get your whole hand.
So I got to get both.
And here's a quick tip, because I actually did mine the day before Thanksgiving, and I think there were 16 people there, because you go based on the time, how many people are scheduled. And because you haven't eaten the day before,
you're going to go crazy.
If your appointment is 8 o'clock, 8:30, you're gonna hate yourself. I had to be there like 5:45. I was like the 5th or 6th person to go, and I was out of there and headed to eat breakfast before the sun came up.
Okay.
So get it schedule it, and
Good
then
tip.
my stomach was completely empty for Thanksgiving.
That's
So
good.
it's a little
that's strategy.
Yeah, that's strategy.
That's good.
Yeah.
And then like it may kickstart. It can very well kickstart like just a change in how you eat and how you know how you think about food. And
But
all
I
that.
have pancakes and bacon too, so you know.
Yeah, I mean, if I didn't starve myself for a test, I'm going crazy.
Yeah.
All right. So what's hot in health? The second Sunday in March, April. We're looking forward to a hot show. More tips, tools, tricks, skills, and all the things you can use. Supplements too, maybe. Get that nutrition in order. If you need help with any of it, call MedsPlus. How can they find you again?
You can call us 205-650-4636, or you can text us, or you can email us info@medsplusconsulting.com. And we also have a website, medsplusconsulting.com.
All right. MedsPlusConsulting.com. Yeah, this is a big, busy week. This will get you moving for sure. So be sure to follow all of my social media. Watch Woo Work everywhere and catch up with everything that's happening. I expect to see you out and healthy, bringing in the spring season. Let's get to it. Jay Hat, I'll see you out this week.
Yes, sir.
All right. Y'all be vital.